Hello and welcome. I am Dr. Ankit Parakh. I work as a consultant in pediatric pulmonology, allergy and sleep medicine at Children's Chest Clinic, New Delhi. Don't let your allergies or asthma stop you. That is what we are going to discuss in this video. A lot of children have allergies of the nose or nasal allergies. They have eye allergies or allergic conjunctivitis. They have skin allergies, also called as atopic dermatitis or eczema. And many children have chest-related issues, chest allergy, also called as asthma. Now, allergies can be seen in approximately 15 to 20% of children throughout the world. Many children with allergies and asthma have symptoms which leads to a poor quality of life. They're not able to do their daily activities properly. They're not able to participate in sports. They're not able to sleep properly. They can be having daily symptoms like cough, breathing difficulty, breathlessness. Now, with proper care and treatment, all these children can lead to an absolutely normal life. There are adults with asthma who have won Olympic races. There are adults with asthma who have climbed up to the Mount Everest. So there is nothing which stops you from achieving anything in life. So let's first understand how asthma affects our lives. Now, as we know that our lungs have airways, and these small airways called bronchi, when they get exposed to allergens, triggers or viral infections, in children who are predisposed to have allergies, the airways becomes inflamed or swollen, they have mucus inside, and the muscles can tighten up. Now that leads to symptoms of cough, breathlessness, wheezing, and children not able to do exercise properly. In some children, these symptoms could be daily. They can have nighttime awakenings. They wake up at night, they're not able to sleep well. And these symptoms can be there on most days. Now, in addition to these daily symptoms, many children will be having asthma attacks. Now, during these asthma attacks, children would be having increased cough, breathlessness, wheezing, which demands emergency care, emergency visits to clinics, to emergencies, to hospital emergencies, and sometimes admissions to hospital as well. Now, there are very common questions which parents ask me. Can my child do good physical activity? Can my child exercise? Can my child participate in sports? Well, with due precautions and care, all children with asthma can do all activities normally at school and at home. It is an aim of asthma treatment that children should be able to exercise without any problems. They should not be having cough, wheezing, breathlessness during or after exercise. Now for that, we need to do two things. One, we need to be taking our preventive inhaler regularly in the dose which has been prescribed. That keeps the inflammation or swelling absolutely well inside the airways, and hence the chances of having any symptoms during exercise becomes really low. There would be occasional children who still might have some symptoms in exercise. In this situation, we can use a short-acting bronchodilator in the form of an inhaler prior to exercise to relieve these symptoms. For how much dose and what inhaler to be used, you need to consult a pediatric allergist or a pulmonologist. The other common question which parents ask me is that, can we travel? Can we go on a holiday, but my child has asthma? What will we do? Again, the children with asthma should be able to travel anywhere across the world. Having asthma doesn't mean that you need to stay at home. No, that doesn't mean that. But still, you need to take precautions. And again, as I said, you need to take your preventive inhaler regularly to keep absolutely well. Now, in addition, if you are traveling, you need to carry your reliever inhaler and you need to understand that when you need to take your reliever inhaler. You need to have an asthma action plan which we provide to all our patients so that they understand that what should be taken at what point of time. And it is always a good idea that before you travel, you have a consultation with your pediatric pulmonologist or allergist to understand that the asthma is doing good and what all you need to do, what all you need to carry when you are traveling. So can children with asthma and allergy lead a normal life? Absolutely. All children with allergies and asthma can have an absolutely normal life, and that is the aim. For that, you need to do a few things. Be in touch regularly with your allergist or pulmonologist so that they can guide you regarding treatment. Take your preventive inhalers regularly without reducing or increasing the dose on your own. That is going to keep your symptoms absolutely well. That is going to keep the inflammation inside the airways very low or absent, and hence you will have no symptoms. Understand from your allergist or pulmonologist that how is an asthma action plan to be used for your child. When do you need to use your reliever inhaler? When do you need to take any other medicine? And what all you need to do to keep your child well. Do not increase or decrease your medicines, which is a very common practice in India. Do not try and self-treat yourself or your child. So if your child is having allergies or asthma which are troubling them, do get in touch with a pediatric allergist or pediatric pulmonologist. They can help you with the diagnosis. They can help you knowing a lung function for making a proper assessment of the child. They can also do an allergy testing to understand what allergens are causing the problem in the child, and they can help you guide treatment. For more information, you can log on to our website ankitparakh.com. Thank you.